Hi everyone, welcome back. So it's been a little while since I've last put a new post on here, so I thought it was about time to come back to you all. And today I'm going to be talking about something called PMDD, which stands for Premenstrual Dysphoric Disorder. And a lot of people haven't even heard of this. But I'm sure, pretty much everyone has heard of PMS or premenstrual syndrome, which can cause various symptoms due to hormonal changes, at the time of the month. Now, PMS will affect around 40 million women, and over 5 million of these women will take some form of medication, for those symptoms. But usually once the period starts, the symptoms will fade. Now, between 2.5 and about 5% of those with PMS will also describe it as, a debilitating, condition. And up to 5% of women of childbearing age will suffer with PMDD, which is basically like a severe form of PMS, usually characterized by the severity of the symptoms, which are not only physical symptoms. It's not just about, having really bad stomach cramps or bleeding heavily, but also it's really characterized by extreme behavioral and emotional, symptoms. Depression, anxiety commonly present alongside PMDD, and normal functioning really, becomes very, very difficult. Hence why natural therapies such as massage are really becoming more popular as a form of treatment for this. Now, in terms of the causes of PMDD, there's not really been a definitive cause found, but research has suggested various possible causes. Now, one is the levels of serotonin. So serotonin is one of those mood-enhancing endorphins that is often released by massage. And these levels will change throughout the menstrual cycle due to, fluctuating hormone levels. And this could potentially explain the mood changes, as some women may be more sensitive to these changes. And that's why, they're more likely to develop the PMDD. Also, high stress levels. High stress levels mean high cortisol levels, which then cortisol inhibits progesterone, which can potentially cause a predominance of estrogen following ovulation. Now, this is because basically progesterone levels counterbalance the estrogen levels. Now, estrogen dominance will explain things like bloating, sugar cravings, because estrogen will attract fluid and also cause salt retention, and also drops in blood sugar. So, the other possible cause, genetic predisposition, in terms of, sensitivity to receptors and efficiency of those sex hormone signals within cells. But as I say, none of these have really, 100% been, proven to be a cause of PMDD. So a lot of it is still kind of guesswork. Now, in terms of the diagnosis of PMDD, again, there's no single diagnostic test, which of course is the case with a lot of these sort of hormonal and sort of gynecological issues. Now, exclusion of other medical conditions that could explain both the physical and the emotional symptoms, in sync with the menstrual cycle, will certainly help with diagnosis. If none of these other sort of issues are present, then, it's more likely to be put down to PMDD. Differential diagnoses include anxiety disorders, thyroid dysfunction, substance abuse, menopause. They're probably the most common ones. Now, also, what will help with diagnosis is having a history of 2 consecutive menstrual cycles exhibiting luteal phase symptoms. And, it's advisable, if you think that this may be something that you're going through, to, always keep a daily diary of, 2 to 3 months, just to help identify the frequency and severity of premenstrual symptoms. And you want to look at the probably 3 to 5 most acute physical symptoms, and also the most acute emotional symptoms that arise in the 2 weeks prior to menstruation. Each symptom you can rate on a scale of 0 to 10, so 0 indicating no symptoms and 10 indicating the most severe. So, in terms of symptoms, the symptoms of PMDD, as I said, they can be really debilitating. They'll interfere with relationships, they'll interfere with work. This is why women are really quite desperate to kind of find a treatment that works and find an answer to what the problem is. Now, so in terms of emotional and behavioural symptoms that occur, we could be talking things like antisocial behaviour, depression and uncontrollable, crying spells and feelings of sadness, maybe panic attacks and anxiety, poor concentration, irritability, anger, just feelings of being out of control, and real severe mood swings sort of past what you would normally get with normal PMS. And this may even, get to the point where there are thoughts of suicide. But generally, as well, just a lack of interest in daily activities, even the things that you would normally enjoy, and relationships. Now, in terms of the physical symptoms, again, you're really looking at sort of common things that would occur with PMS, but, they may be more severe. So things like headaches and migraines, abdominal cramps, fatigue, fluid retention and food cravings, binge eating, abdominal bloating, possibly joint and muscular pain, breast tenderness, and also probably problems, getting to sleep. So, there's quite an array of symptoms. Now, it may be, that you get more the emotional symptoms and not so much of the physical. But as I say, if you keep that diary, and that will really help, your doctors to, to be able to diagnose. So in terms of treatment, what can you do if you suspect that this is the issue, or if you've actually been diagnosed? So there's various forms of medication that you can take. SSRI, which stands for Selective Serotonin Reuptake Inhibitors. These type of antidepressants, so we're talking things like serotonin, fluoxetine, paroxetine hydrochloride. These will alter the serotonin levels, which, remember, is that mood-enhancing endorphin. and taking these has shown some improvement in 60 to 70% of patients. Also, non-steroidal anti-inflammatories, so things like your ibuprofen and naproxen, can certainly help ease the cramps, headaches, any breast tenderness or joint and muscle pain. Then you've got things which are called GnRH agonists, so something like leuprolide, which can basically help suppress ovulation and treat, PMDD when it's really quite unmanageable. But this is not ideal for long-term use because it can really encourage irreversible bone loss, which of course, nobody wants. So, that would probably be more towards the last resort kind of stage, and certainly better to try the other options first. Also, hormonal therapy may help. Combined oral contraceptives containing drospirenone are specifically approved for treatment of PMDD, and these will usually see an improvement in about 48 to 60% of women. So also worth a go. Now, as always, one of the things we always mention as a treatment option, exercise. I can see you all rolling your eyes, but aerobic exercise such as a 30-minute walk, bike ride, swim, or any other kind of aerobic activity is recommended 4 to 6 days a week for those with PMDD to increase endorphin release, improve mood, and also help to ease fatigue levels. And research has, particularly shown that yoga is beneficial for PMDD in improving menstrual health in general, as well as to regulate breathing, ease muscle tension, and reduce stress and promote relaxation. And the poses that are particularly recommended for menstrual problems are the bridge, the downward dog, and the butterfly. So do try those. Now, other treatment options that you can try, certainly nutrition. Eating small, frequent meals to help prevent bloating, eating plenty of fruit and vegetables, high protein foods to help increase the tryptophan levels, which tryptophan will certainly help regulate your sleeping patterns. Pumpkin seeds are particularly high in tryptophan. Also eating complex carbohydrates, so whole grains, over processed carbohydrates, really aren't great. Basically, the research shows that blood levels of that tryptophan that we've just mentioned will be raised with complex carbohydrates, and this then converts to serotonin, which is the endorphin, the feel-good hormone that sort of induces feelings of well-being, but also whole grains and vegetables will help to avoid bloating as well. Low-fat vegetarian diet has also been shown by research to reduce the duration and also the severity of pain and bloating, and this is because meat and high-fat foods tend to increase prostaglandin levels, which may increase menstrual cramps. So there may be a lot to be said for vegetarian diets. Omega-3 fatty acids, so it's, in oily fish, things like salmon, mackerel, tuna, have also been shown to reduce menstrual pain. avoiding salt and salty snacks, certainly in weeks 3 and 4 of the cycle, so between ovulation and menstruation. Best avoided, and that will help also, that water retention and increased bloating. Reduce your sugar intake in weeks 3 and 4 of the cycle, because this is where you may get drastic, blood sugar, fluctuations, which again is going to worsen fatigue and mood swings. Now, caffeine, again, in weeks 3 and 4 of the cycle, avoiding caffeine if possible, avoiding alcohol, and again, that will just help with those fatigue levels. So there are also some supplements that you can try. Research has shown some benefits in using calcium. 1200 milligrams per day may ease the physical and emotional symptoms, but you do need the vitamin D to, for your body to be able to absorb the calcium. So if you're going to take a calcium supplement, do take one that includes some vitamin D. And also it's, it may be a good idea to take one that has a little bit of magnesium in it, because of course calcium and magnesium are in balance in the body. Also vitamin B6, taking sort of 50 to 100 milligrams a day may help relieve depression, that's associated with PMDD, and also, help with the energy levels, ease fatigue, irritability, and insomnia. Other things that may be beneficial, we mentioned there about magnesium, 400 milligrams a day is good for cramps, and also just to maintain the balance with the calcium, and it can also ease breast soreness and bloating. Folic acid, 400 milligrams a day. Vitamin E, 400 a day, may reduce prostaglandins in the body, which again cause pain. Other alternative therapies that you can try, evening primrose oil, has long been recommended for any kind of hormonal or menstrual problem. Acupuncture works for some people. Sometimes, people just don't respond to it, but it's worth a go. Reflexology. Research has shown that foot, hand and ear reflexology reduced PMS symptoms by 46% during an 8-week treatment period, with reduced symptoms for 8 weeks afterwards in 42% of participants. Now that's in PMS, not PMDD, but certainly it's worth a go. And massage, of course, which I'm going to talk about a bit more. Long-term improvement has been shown in pain and water retention, and also short-term improvements in, in terms of decreasing anxiety and improving mood. But other things, Chinese herbal medicine. So we mentioned about evening primrose oil, sort of 50 to 1,000 milligrams per day. Also St. John's wort may help relieve anxiety and depression and those feelings of irritability. But do be aware that St. John's wort, it can increase UV sensitivity. And it doesn't interact well with some medications, so do check that, with your GP. And yeah, obviously, if it's sort of summer and, the sun's out, you probably just want to make sure you wear some sunscreen if you are taking that. Another one is ginkgo. 40 milligrams 3 times a day may help reduce bloating, fatigue, insomnia, may help with concentration and migraines. And this is basically by reducing again those prostaglandins in the body and also increasing the release of neurotransmitters in the brain. Light box therapy is another one for depression. We know that it works with seasonal affective disorder. It may help promote the secretion of serotonin, which enhances the mood. So again, it may work for depression associated with PMDD. Aromatherapy, as always, has its uses, whether it's through inhalation, blended in oil for massage, in the bath, used as a hot compress. It may reduce stress, improve sleep, and relieve those cramps. But you must ensure that oils are properly diluted. Now, suggested oils. Geranium is great for restoring hormonal balance. Chamomile, lavender, marjoram, and melissa all are great for menstrual cramps. Clary sage, great for depression, anxiety, and also the cramps. Grapefruit or juniper for water retention. Chamomile will also, along with lavender, promotes relaxation in general and also help to promote sleep. And rose and neroli are great for reducing stress and anxiety. So give those a go too. Other forms of stress management are always going to be beneficial. So we've talked about how exercise can, increase the release of those endorphins and help relieve stress. Other things, we've mentioned about massage. Certainly meditation has been shown to reduce anxiety, depression and pain by focusing on the present moment and your breathing. A warm bath, and again, with some of those aromatherapy oils, can be great for, easing the cramps, easing anxiety. You can promote good sleeping patterns to also help reduce anxiety and fatigue, and that in turn, that's going to help your coping ability in terms of pain. So in order to promote good sleeping patterns, go to bed the same time each night. Don't take naps during the day. Avoid caffeine and other stimulants such as alcohol, for several hours before you go to bed. Only use the bedroom for sex and sleep. So, TVs and phones and computers in the bedroom, not a great idea. Avoid all kinds of technology in the bedroom. Also maintain a comfortably cool temperature. And, you may find that reading or taking a warm bath before bed just to help you relax a little bit more is also helpful. Other treatment options you can try. Cognitive behavioural therapy, if most of your symptoms are emotional and behavioural, this can be effective, in helping those with significant anxiety and stress just deal with it a little bit better. Surgical therapy, this really is a last resort for those with unmanageable symptoms. An oophorectomy, so basically removal of the ovaries, may be considered, but it is a last resort. And there would be a 3 to 6 month trial of those GnRH agonists, which suppress ovulation that we spoke about earlier. You can also change your menstrual products. Tampons may make PMDD symptoms worse, which may cause further cramping. So do try using either all organic pads, or you can try menstrual cups, which are worn internally to collect menstrual flow. Now, a course of treatment for 3 to 6 months is thought to be best for any hormonal issues, so that an overall picture of the condition and symptoms can be seen. and that of course will help you to manage it more long term. Now, so as we mentioned there, one of the treatment options was massage, so we're going to talk a little bit more about that now. Now, research has shown that having massage treatments at specific times during the menstrual cycle will help to improve symptoms. Now, for PMDD, a massage each week in certainly the 3rd and 4th week of the cycle is recommended. So between ovulation and menstruation, which is where most of those symptoms will arise. Massage can incorporate, acupressure, acupuncture, aromatherapy, heat, to further help relieve those symptoms. Now, the benefits of massage for PMDD, certainly reduced anxiety, which, due to a balancing effect on the nervous system, on the parasympathetic nervous system, which calms everything down, and also on the hormonal system, which inhibits secretion of those stress hormones such as cortisol that, really sort of bring on those feelings of anxiety, panic attacks and things like that. Massage will also help prevent bloating, salt retention and those blood sugar, sort of spikes. And this is due to, these occur due to estrogen dominance. So by inhibiting the cortisol release, this will promote the release of progesterone, which will counterbalance those high estrogen levels. Reduce depression due to, again, increased secretion of those endorphins, such as serotonin, which help to enhance the mood. And also pain relief. So by reducing the levels of those prostaglandins, which increase inflammatory cytokines, this will help to, ease any pain. Reduced water retention, bloating, regulating the hormone levels, as we've said, inducing relaxation and therefore promoting good sleeping patterns, and also then sort of increasing the client's ability to then deal with pain when it does arise. Everything's better when you've had a good night's sleep. Massage also will help ease fatigue, improve concentration, ease headaches, and just generally relieve muscle tension, as it would in anyone. Now, initially, massage treatments for PMDD would start with Swedish techniques, but once improvement in symptoms is noted, this may progress to a deep tissue, but every case, would be treated, as a sort of individual case. As with any medical condition, it's really important that if you are looking to get treatment for this, that you seek treatment from a registered and qualified therapist who is experienced in dealing with these issues. And they will be, much more able to not only do an appropriate treatment for you, but also to plan a sort of a long-term, sort of treatment plan. But yeah, so that's really how massage can help with PMDD. And do give it a go. I run a women's health clinic, and I have quite a few women with various hormonal conditions, and a few with PMDD. and certainly massage has really helped them. But as always, you know, if you've got any questions at all, feel free to message me. You can message me through here, or you know, through my Facebook page. I'm on there as the Medical Massage Lady, also on Instagram, and I will come back to you. And there will be a website coming up very, very soon as well. It's not quite up and running yet, but again, that will be up as the Medical Massage Lady. So yeah, if you want to know any more, you can also subscribe to my channel. There are various other posts about women's health issues on here already, so things like endometriosis, the menopause, you know, pelvic floor, you know, there's all sorts on there, so do take a look at those as well. But for now, that is all from me, so I will see you next time. Take care. Bye.